We have seen that Obamacare is going to come with crippling costs for families. The CBO evaluation for Senator Bai is the only documentation we've uncovered that shows what it will mean to a household. The total cost was $940 billion in 2009, but now the cost estimate is $1.76 trillion 2 years before it gets fully implemented. So let your imagination run wild as to what it might be in 2014. However, many people would counter that they have health insurance through their employer. Why would companies stop providing insurance? This Forbes survey reached 71 of the Fortune 100, and they concluded that those companies would save $422 billion in the first 10 years of Obamacare. Those firms would save $28.6 billion alone in 2014, an average savings of $402 million per company. Why would any company consider saving that much money on their bottom line when there was an alternative for their employees to get health insurance? Leading consulting firm McKinsey did a study of over 1,300 employers from 48 states that said 58% of well-informed employers would most likely end their plans. Even more frightening is the fact that the original estimate was based on only 7% of employers dropping their plans. If respondents follow through, the 2009 estimate would need to be increased by an additional $1 trillion.
The public option is not your enemy, it is your friend, I believe. Let me also address an illegitimate concern that's being put forward by those who are claiming that a public option is somehow a Trojan horse for a single-payer system.
Someone once said to me, this is a Trojan horse for a single payer. And I said, well, it's not a Trojan horse, right? It's just right there. I'm telling you, we're going to get there. Over time, slowly, but we'll move away from reliance on employment-based health insurance, as we should, but we'll do it in a way that we're not going to frighten people into thinking they're going to lose their private insurance. We're going to give them a choice of public and private insurance when they're in the pool, and we're going to let them keep their private employment-based insurance if their employer continues to provide it.
So here we have the president insisting his plan is not a Trojan horse for a single-payer system. As Lieutenant Columbo would have said, geez, isn't that funny? Dr. Jacob Hacker, the Yale PhD and architect of this plan, mocked the notion there was anything except a Trojan horse for single payer. Do you see the contradiction, sir?
Next to me was a guy from the insurance company who then argued against the public health insurance option, saying it wouldn't let private insurance compete, that a public option will put the private insurance industry out of business and leave single payer. My single payer friends, he was right. The man was right.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years.
So, Mr. President, we only have one question. Are you angry that people don't like your plan, or that you got caught in a blatant and provable lie?